Health officials here in Los Angeles are urging those eligible to get the updated Omicron booster shot. Now, those shots are available in more than 1,500 locations across the county. And one of those sites is Kedren Community Health Center in South Los Angeles. Joining us to discuss this is Dr. Jerry Abraham. You are the Director of Vaccines at Kedren. So what is happening at Kedren? Are a lot of people coming out to get this booster shot?
That is what we've been doing at Kedren, is making sure that Black and brown populations that are often hard to reach, hardly reached, have access to COVID-19 resources. And that's still what we're doing today. We have vaccinated nearly 400,000 people and tested hundreds of thousands of folks. We've also now provided therapeutics. You might have heard of Paxlovid, some other interventions. We do a lot of community engagement and patient education, along with really making sure that our communities are pandemic ready, including dealing with the realities that people are still living with COVID.
When the pandemic first started and the vaccine first came out, I remember visiting Kedren, and there were people coming from all over, Orange County, other countries. How do you make sure that the local folks get the vaccines that they need?
Absolutely. If you remember those, honestly, kind of dark days, it felt like a boarding gate at LAX where there were zones, priority 1, 2, 3. We wanted grandma and grandma to walk right through. Those who had mobility issues or couldn't see, couldn't talk, couldn't walk, those folks came right through as well. We also made sure that we piloted those from the zip codes hardest hit. For example, in South Central and South LA, we're able to walk right in and get their shots. And so that's really how we made sure we prioritized those with the greatest need come first. And that's really what health equity and also righting the wrongs of racism in the past as we address racial justice is to make sure Black and brown populations, you should be first in line to get these treatments. They are for everyone.
You and your team went to churches.
Absolutely.
You took the vaccine.
Absolutely. Oh, it was like an altar call. Oh, yes. The minister would ask us to come up and speak. And then we would say, these vaccines are for you. They're not just for rich people or white people. People needed to hear that. They needed to know. They needed to see their pastors, their leaders, their teachers, their coaches, their respected elders getting vaccinated in front of them. And that built trust. And we'd literally be in the back of the congregation. And as people are ushering out of services, they were rolling up their sleeves and getting their shots. People go to church and they get healing, for their soul. We wanted to also provide healing for their bodies. There's a beautiful space that we can be at in sacred spaces like churches, but also in educational spaces like schools. People go to work. Why not meet them where they are going and they're bending over backwards to put food on their own tables and keep a roof over their head? Let's make it easy for them. Let's come to them and help them there. It's not brain surgery. It's not rocket science. I don't know why it's taken so long for us to get here.
Absolutely. Did you work at all with the councilman's office?
Absolutely. Yeah, this has been nothing short of a labor of love, and all of us having to come together with the city and the county and the state and at times the feds. And that's what scares us now. As President Biden, I truly believe, carelessly or recklessly said the pandemic is over, that has real implications for whether or not people in our community are choosing to get these Omicron bivalent boosters. And that's damaging and hurtful. And we're very concerned with federal resources coming out of COVID. Will my people have access to tests, to therapeutics, to vaccines? That's scary. So the commitment we're making from Governor Gavin Newsom's office on down, from the California Department of Public Health assuring us, don't worry, we will make sure you have those resources, especially for Black and brown communities right here in South and East and Southeast LA, are really critical messages. And we're hearing that from our local county supervisors and the Department of Public Health right here in Los Angeles, and from Mayor Garcetti, and from Councilman Price, Marquise Harris Dawson, and multiple others that have stepped up to make sure that our people continue to get the resources and the care that they need and deserve. Our people deserve to live just as much as everyone else, and our goal, as I always say, best life, longest life, healthiest life, happiest life. That's for everyone, regardless of your socioeconomic status or what race or ethnicity you are.
And you mentioned some of the conspiracy theories. I mean, I've heard it all. Like you said, there's chips in the vaccine. How do you dispel those myths?
Part of it is understanding that some people need to hear it multiple times. For some, it may be 1 or 2 times. For others, they really need to feel comfortable. It might take up to 15 times. My team is out there every day with street medicine and mobile medicine. We have been threatened. We've been told to leave our community. Don't you bring those vaccines to our community. We're in gang territory as well, right? So there's a lot of those kind of safety concerns and risks. Some of those individuals over time have changed their hearts. They've softened their stance. In fact, some of those folks have actually gotten vaccinated. It's because we built trust. They knew we weren't here just to tell you to roll up your sleeves, trust us, take this medicine, never see us again. That's not what health and being healthy is all about. We need to be ever present. We need to be an institution that can be trusted. And that trust really was missing, which is why it was so hard in the beginning to really get Black and brown individuals to come out. And really briefly, I've talked about this before, the medicalization of racism. So when we talk about the Tuskegee trials, where Black men were denied treatment of syphilis, Latinas were denied good care here at LA County, where they were sterilized against their risk. Black individuals are not treated for pain equally or appropriately in our hospitals. These are real, these are lived experiences. I think of Henrietta Lacks, her DNA abuse, her family not getting credit. So when you ask people why are they not coming, I don't think that's a fair question. You're putting the burden on them. I think we have to say, acknowledge this and say we totally get why. We have a much longer journey that we need to cross together for you to trust us in order to take our recommendations seriously.
How do you think we did here in LA in terms of addressing the pandemic?
I think the county had made an equity committee, and that helped tremendously. Many of us came together with the County Department of Public Health, the city councilors, the mayor stepped up, the supervisors stepped up. In many ways, we were committed to not making the same mistakes as Chicago, Washington, D.C., many other jurisdictions where the vaccines landed in the exact opposite zip code of where the suffering and the COVID were.
More affluent communities.
We looked at geographic data. We looked at where COVID was. We did some geo mapping, and we said we're going to take them to these zip codes, we're going to take them to these communities, these households. Imagine if one person had COVID in your house, don't you think that makes sense to get that whole house vaccinated? Because they've already demonstrated they're at highest risk. And so by implementing many of these very smart strategies, rather than sitting in a room, doing whiteboard exercises, calling consultants, we were real-time informing the process. And I really believe because of that, many people were saved, many people did not catch COVID, and we did not have the deaths and the suffering that could have been had we not taken equity seriously.
What illnesses do you see the most often?
Well, one of them, the trifecta, I call it, is diabetes, hypertension, and hypercholesterolemia. And high cholesterol leads to strokes and heart attacks. Those three often go together, and they're very much so lifestyle illnesses. We're not moving as much as we used to. We're eating processed and fast foods, more oils and fats than ever before. So we're not surprised that we're seeing these diseases of luxury that, our predecessors have not had to deal with. And so we really need to figure out a way how to address that. These enormous amounts of calories that we're faced with, and then the lack of movement. All of this is resulting in disease and disproportionately affecting those that are lower socioeconomic status and definitely communities of color. So we need to get better about how we're going to tackle that epidemic. So one of the best things that we can do is we need to schedule those preventive maintenance appointments, go in and kind of, just like you get your car tuned up, it's time to kind of really see, where am I at? Have I screened myself for all those cancers, colon cancer, breast cancer, cervical cancer? These are all things that now that, we've got a chance to breathe, the COVID numbers are down, let's catch up on all that missed care that we all need and deserve. So again, live our longest, healthiest, best, highest quality life. And that should be, as the physician, that I hope is all of our goal in the healthcare side, patients too. So when we align those incentives and goals, I feel like that's how we're actually going to get there.
That is going to do it for this edition of LA Currents. I'm Anita Bennett, and thank you for watching.